B-complex with vitamin C is a combination of B vitamins that are essential for maintaining good health. It is used to treat or prevent vitamin deficiency caused by a poor diet, certain illnesses, alcoholism, or during pregnancy. B vitamins are important for the body and include thiamine, riboflavin, niacin/niacinamide, vitamin B6, vitamin B12, folic acid, and pantothenic acid. Some brands also include additional ingredients such as vitamin C, vitamin E, biotin, or zinc. It's important to consult with your doctor or pharmacist if you have any questions about the specific ingredients in your brand. This supplement can help support your overall health and well-being, and it is especially beneficial for individuals who may not be getting enough of these vitamins from their diet. The recommended daily dosage can vary depending on individual needs, so it's important to follow the instructions on the label or as directed by your healthcare professional. As for the optimal timing, it's generally recommended to take B-complex with vitamin C with a meal to help with absorption. Taking it in the morning with breakfast can be a good option to start your day with a boost of essential vitamins. However, it's best to follow the specific instructions provided with the product or as advised by your healthcare provider. When taking B-complex with vitamin C, it is usually recommended to take it once daily or as directed by your doctor. Make sure to follow all the instructions on the product package. If you are taking a brand that contains vitamin C, be sure to take it with a full glass of water, unless your doctor tells you otherwise. If you are using chewable tablets, make sure to chew the tablet thoroughly before swallowing. For extended release capsules, swallow them whole and do not crush or chew them, as this can increase the risk of side effects. If you are using a liquid product, make sure to use a medication measuring device to carefully measure the dose and do not use a household spoon. Some liquid products may need to be shaken before each dose, and some products containing vitamin B12 may need to be placed under the tongue before swallowing, so be sure to follow the label directions carefully. It is important to take this medication regularly to get the most benefit from it, so try to take it at the same time each day to help you remember. If you experience mild upset stomach or flushing, don't worry, these effects are usually temporary and may go away as your body gets used to the product. However, if these effects persist or worsen, let your doctor or pharmacist know. Your doctor has prescribed this medication because they believe that the benefits outweigh the potential risks of side effects. Most people who use this medication do not experience serious side effects. While it's rare, a very serious allergic reaction to this drug can occur. Seek medical help immediately if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects, be sure to contact your doctor or pharmacist. Remember, in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking B-complex with vitamin C, it's important to talk to your doctor or pharmacist if you have any allergies or health conditions, such as diabetes, liver problems, or vitamin B12 deficiency. If you have phenylketonuria or need to restrict your intake of aspartame, be cautious with chewable tablets or liquid products that may contain it. Liquid forms of this product may also contain sugar and/or alcohol, so consult your doctor if you have diabetes, alcohol dependence, or liver disease. It's also important to inform your doctor about all the products you use before undergoing surgery. If you are pregnant or breastfeeding, consult your doctor for more information on using this product safely. It's important to be aware of potential drug interactions with B-complex with vitamin C, as they may change how your medications work or increase your risk for serious side effects. Some products that may interact with this drug include altretamine, cisplatin, certain antibiotics, certain anti-seizure drugs, levodopa, and other vitamin/nutritional supplements. Additionally, this product may interfere with certain lab tests, possibly causing false results. It's important to inform your lab personnel and doctors that you are using this product. When taking B-complex with vitamin C, it's crucial to keep a list of all the products you use and share it with your doctor and pharmacist. It's also important not to start, stop, or change the dosage of any medicines without your doctor's approval. If you or someone you know has overdosed on B-complex with vitamin C and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek medical help immediately. In the U.S., you can call your local poison control center at 1-800-222-1222 for assistance. In Canada, residents can call their provincial poison control center. Symptoms of overdose may include stomach pain, nausea, vomiting, and diarrhea. It's crucial to seek medical attention if you suspect an overdose. Be sure to keep up with all your medical and lab appointments. Remember, this product should not be used as a replacement for a balanced diet. It's always best to get your vitamins from nutritious foods. B vitamins can be found in leafy greens, vegetables, meat, fish, poultry, and enriched breads and cereals. If you forget to take a dose of B-complex with vitamin C, take it as soon as you remember. But if it's close to the time for your next dose, just skip the missed one. Don't take extra to make up for the missed dose. Remember to take your next dose at the regular time. Make sure to check the storage information on the package, and if you're uncertain, ask your pharmacist. Always keep medications out of reach of children and pets. When it comes to disposing of this product, don't flush it or pour it down the drain unless instructed. Instead, properly discard it when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for more information. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.